A warm welcome from the Geneva Learning Foundation. This is Rida Sadki. I'll be your host together with Charlotte Mbu. How are you, Charlotte?
Hi, Reda. Hi, everyone. I'm doing great. I'm really excited to join this Teach to Reach Connect today.
And so we are going to kick off the warm-up session in just under 4 minutes. As you can see by looking at your screen at the countdown timer, this is the 8th time that we are holding Teach to Reach following the original Teach to Reach conference in January 2021, a historic moment for immunization professionals from all over the world following the Teach to Reach program in 2020. In the middle of the pandemic, we came together. Over 7,500 immunization professionals came together initially to share knowledge, learning experience, and then to network, to build their professional networks, to build your professional networks, our professional networks together, is so successful that we decided we had to do it again. And this is now our 8th time doing it. You can see we're counting down now. The warm-up is especially for those of you who are new to Teach to Reach, who are attending perhaps for the first time. Maybe you had a colleague or someone who's already a Teach to Reach participant who recommended it, so that whatever reason brought you here. Maybe you found us with a Google search. We want you to feel the warm welcome that we'd like you to receive, not just from me and Charlotte, but also from Teach to Reach participants, from the Teach to Reach family. You'll learn today, if you do not know already, about the movement for Immunization Agenda 2030, and you'll learn about many other topics, not by listening to experts present expert information, but by sharing with your colleagues, people just like you, perhaps in countries halfway around the world, who are also facing challenges, dilemmas, and trying to find solutions to resolve these challenges and dilemmas. And we believe that by connecting with each other in this way, it is much more likely that we will find solutions. And I want to... I see a question about switching to Hopin. So, in principle, if you followed the instructions following your sign up for Teach to Reach, you should be here in Hopin, and you can see there's quite a bit of discussion already going on. So let me see. Yeah. So hello to Rajendra Kumar Singh from India, Dr. Rajendra from India, and you can see here, right. I'm seeing here, you can see my own live stream here. Euripidi Avokpao from Benin has also joined us, and Zebo Benjamin DB from Ivory Coast, Aishatu Gubio from Nigeria, Sawadogo Wandan Megde is also here, Pala Umar from Cross River State, Nigeria. Much delighted, he says, to be part of this noble program. We're delighted to have you. And I believe we're now at the countdown mark, so let's... Here we go. All right, 30 seconds until we kick off the warm-up session for Teach to Reach. Make sure your seatbelt is fastened and get ready for takeoff. All right, here we go. A warm welcome to you from the Geneva Learning Foundation. Today, I am not in Geneva, Switzerland, but in Bangkok, Thailand, and very pleased to be broadcasting from the Asian continent. I'm here with Charlotte Mbu. Charlotte is in Ibolova, Cameroon. How are you doing, Charlotte?
I'm doing great, Great, Reda, and a warm welcome to everyone's pleasure to connect with you today. We have events, we have occasions for peer learning, but we have Teach to Reach. It is different. Apart from the plenary sessions where we get to share experiences, you have the ultimate opportunity to connect one-on-one with peers from across the globe.
All right, here we have some photos of the two of us, just so you can imagine us. We won't be, for bandwidth and connectivity and technical reasons, you won't be seeing us today, but connectivity is a shared problem. Just to let you know, if you can't hear properly today, if you'd like to speak but you're not able to, I encourage you to subscribe to the Geneva Learning Foundation's podcast, and there's actually a specific Teach to Reach podcast, and that will give you a great way to listen, like listening to the radio or listening to an MP3, listen to the experiences shared and the learning that is going to take place today. This is Teach to Reach Connect. The purpose of today's event is really to meet, network, and learn. And we'd like to kick off with the first question in the Zoom studio. We have guests of honor who are include leaders of the Movement for Immunization Agenda 2030, as well as those of you who made contributions to Teach to Reach before the event. So we're going to kick off first with, let's see, who will be our first speaker. Please raise your hand if you'd like to contribute. Otherwise, we will volunteer you. Let me see, who would be nice to hear from. What do you expect from today's networking event? And if you are in the in the hop-in, then please let us know in the comments. Let me show you how we're keeping track of the comments here. So Matthias from Ibadan, Nigeria, could you answer the question, what do you expect from today's networking event, Matthias? Please type your answer. That way we'll be able to show it on screen. We have Boma Otobo, retired former deputy director of NERIC, who has who is going to tell us what she expects from today's networking event. And NERIC, Boma, how are you? Please do remind us who you are and what you do. All right. And
Dr. Reda, good day, everyone. I think I missed that out. The network, I could not hear you.
Oh, okay.
You said my name. I don't know if you'd like to repeat.
Yeah, we hear you. Oh, and she's gone. Okay, so there will be, everyone is going to have connectivity problems today. Let me go to Dr. Faiza Rabbani. Dr. Faiza Rabbani, and then we'll go to Melissa Teferi, who is with us, two of our guests of honor today, who are with us in our Zoom studio. Dr. Faiza Rabbani, remind us who you are and what you do, and then tell us what you expect from today's networking event.
Assalamu alaikum, and hi to everyone in the 8th Teach to Reach meeting. I am a level 2 scholar from the Geneva Learning Foundation on Immunization Agenda 2030, and it's my third year with the Geneva Learning Foundation. It's what I expect of this meeting is really amazing, because in this meeting I'm not only alone here from Pakistan. I am having my family members who have joined this meeting today. I have a lot of my students, my postgrad students, who have also joined this meeting today. And as a teacher and as a professor of my public health, I'm really honored that you enabled me to jump into the immunization agenda of WHO till 2030. It was a very important and very neglected field where the doctors and the paramedics need to work on. But you developed me, you helped me learn new things, you enabled me to teach new things to others and motivate them to join this immunization agenda. So thank you very much, and I hope to get the same responses from other countries as well. Thank you very much.
Thank you so much, Dr. Faiza Rabbani. Now, the message from Seram Kuga Blenu, who says, I would like to listen to the successes of other health professionals from other countries when it comes to immunization and learn from those stories to improve my work and services. This is, Seram is from Ghana. Again, the question is, what do you expect from today's networking event? Charlotte, who shall we hear from next? I believe.
Melissa Keferi, whose mic is already open, rather.
Wonderful. Melissa, remind us who you are and what you do, and then tell us, what do you expect from today's networking event? And I think the next person, Charlotte, should be someone who's attending for the first time. I believe you spotted at least one person who's in our Zoom studio who fits that description. But let's hear first from Melissa Teferi, who we know as a leader of the Movement for Immunization Agenda 2030. Melissa.
Thank you, Rada. Thank you, Charlotte, to give me the chance to just share my reflections. So I'm really happy to be part of this moment. I'm Melissa Shambo Tafari from Ethiopia, Addis Ababa, and working as a researcher under Ministry of Health Ethiopia. It's a really very important station to share experience from professionals in the globe, from experience in different level of professionals like frontline professionals and programmers and policymakers. So it's very important to share our challenges and solutions, how we can address the immune-related problems and tackle the immune-related problems so that we can improve the health of the children and overall health of total populations.
Thank you, Melissa. That's indeed a very clear agenda. Melissa, have you looked at and have you received and have you looked at the Teach to Reach 7 report?
Yes.
All right, so wonderful. So for those of you who have not, we're going to share the link. It's shared when you register for Teach to Reach 8. So everyone, you have it in your inbox. It's an amazing compendium of a synthesis of the perspectives, the experiences shared by 14,134 health professionals who came together for Teach to Reach 7 in October 2022. For Teach to Reach 8, as we warm up for the event, remember, before the opening ceremony, this is really to help you discover Teach to Reach. I'm going to tell you how many contributions were received before Teach to Reach 8. You are going to be surprised, but before that, Charlotte, I believe we had said we were going to ask someone who is attending for the very first time Teach to Reach to speak. Do you have someone like that?
I invited Nantale Mabel to unmute Rash, who indicated in the chat that they are joining for the first time. I don't know if you're able to speak. I'm inviting you to unmute. If not, I also Omar Tabali, maybe it's not the first time, but I don't think I've heard from him before. So you can listen to Omar Tabali.
Okay.
Good morning, each and everyone.
Yes, we hear you loud and clear. Please tell us who you are, what you do, where you work, and what you expect from today.
My name is Omar Tabali. I'm from Gambia. I'm a public health officer. I'm working with the Ministry of Health. I have been following Teach to Reach, but later I was quite busy with the program. That's the reason why I could not attend. So I just want to share some of our challenges in our country, because we are doing electronic immunization in the Gambia. So I just want to share some of our challenges with regards to electronic immunization. So now, number one challenge is ensuring data accuracy and security, which has to do with improper data entry hacking, which lead to errors in recording and can even affect the security of personal medical data, and also the cost. It's very, very expensive. Implementing an electronic immunization system can be a costly endeavor, requiring the package, hardware, software, and installation of staff and technical support. And the other one is limited accessibility. What I mean by limited accessibility, remote rural clinics may have limited access to internet, because electronic immunization has to do with internet connection. And also system compatibility. The data system of various health providers involved the delivery and tracking of immunization needs to be compatible in order for data to be transferred and shared easily. And also, last but not the least, staff training. The staffs need to be trained to use the new system and input data accurately can be also be a challenge. So these are some of the challenges I want to share. Right now, I'm in the field on a defaulter tracing, but I don't think I will have much to share because here the network too is not very strong. Thank you.
Really, really appreciate you connecting, Omar Tabali. The work, it sounds like you're doing very important work around data and record keeping. So thank you for this contribution. Even if we do not hear from you again, we're still trying to get Nantali Mable, who said that that they were attending Teach to Reach for the first time. So please let us know if you are in that. Yep.
They actually said in the chat they are not able to speak, but they really get to listen in and to learn.
All right, all right. So now, what I'd like to share with you, is the contributions received before Teach to Reach, and this is the most impressive we have ever seen. So, ahead of Teach to Reach, this amazing group of health professionals from all over the world shared 1,251 experiences, 642 of them in English. And then you can see here the contributions by question. And the question that elicited the most sharing of experience is the following. You can see it at the bottom of the table. Why do you work for health? Second question was, if you work in a humanitarian setting, what is your biggest challenge? And then you can see the sort of breakdown. The HPV vaccine introduction question turned out to be raised a lot of interest. The question about digital technologies, which Omar alluded to, had 22 people sharing experiences. Now I can also look at the breakdown by country to see which countries or participants, Teach to Reach participants from which countries shared how many experiences. So we'd like to honor and recognize the countries with the largest number of contributions, and that is, to name a few of them, Nigeria with 268 contributions, Kenya with 96, Ghana with 44, let me see, Cameroon with 29, South Sudan with 15, Uganda with 32 contributions. You can see quite a remarkable set of contributions, with some countries absolutely making a remarkable commitment to the sharing of experience. And then we have the list of names, and I hope, if you can't read this, don't worry. We'll be sharing all of the slides with you after Teach to Reach. So here again, applause and credit is due. Here are the individual names of the contributors from Afghanistan, Angola, Argentina, Bangladesh, Botswana, Cameroon, Canada, Eritrea, Ethiopia, Gambia, Ghana, Guatemala, Guinea, India, Indonesia, Iraq, Kenya, Lesotho, Liberia, Malawi, Maldives, Nigeria, Niger, and you can see the Nigeria list. It actually requires several pages in order to cover all of them. And now we have Pakistan, Papua New Guinea, Philippines, Saudi Arabia, Sierra Leone, Somalia, South Africa, South Sudan, Sri Lanka, Tanzania, and Uganda. You can see this is even before Teach to Reach. These are all of the Teach to Reach participants who took the time to share their experiences. All right, I believe we have Dr. Faiza Rabbani with a hand raised. Is that a new hand or an old hand, Charlotte?
Kindly unmute.
It's a new hand.
Okay. Oh, and yes, and we have Zambia, Zimbabwe, as well as the USA and international contributors. Yes, Dr. Faiza Rabbani.
It's a pleasure to see so many people from the world, and especially to see Nigeria leading the marathon in the first place. We need to see more people from Southeast Asia and countries like Pakistan and India and Bangladesh. We need to work together and especially for Pakistan and Afghanistan, we are still battling with polio, and I would like all other countries to encourage us to end polio in our country. Thank you.
Thank you, Faiza Rabbani, for this. For sharing. Indeed. Now, you may be wondering, where is all this knowledge going? We are sharing experiences, but where do they go? And so, our focus at the Geneva Learning Foundation, really core to our mission, is how do you turn knowledge into action? And that is why we've created the Immunization Agenda 2030 Movement Knowledge to Action Hub, which is a new system. If you have not tried it yet, you can see the link here. We'll be sharing the link after Teach to Reach, so you can try it. And it really gives you access to a number of documents and other resources that can help you in your work, and that is premised on the value of sharing experience. And in fact, we'll be adding the Teach to Reach 7 report to the Knowledge to Action Hub, and continuing to grow the knowledge and experience and expertise that we're able to synthesize so that it can be used by others. Local solutions, challenges, successes, lessons learned, but also those who are finding the path forward. That is what we need more than ever. Now, you received a discussion guide. Just as a reminder, this is actually the discussion guide from a previous Teach to Reach, but in your email, in your inbox, you received what's called either a discussion guide or participants guide, and that contains all of the questions that we're going to discuss or encourage you to discuss. But of course, if you network at Teach to Reach, you're free to discuss whatever you want. We will be asking you questions about, and for feedback, for your insights, reflections about these specific questions very soon. So now, after the first part of the warm-up, we'll be moving into the tutorial session. And if you are having problems of any kind accessing the Hopin conference platform, so that is where we'll be doing networking. And Teach to Reach is fundamentally about networking. I don't want you to miss the networking, and neither does Charlotte. So we'll be doing everything we can to help you get on board the networking platform so that you can enjoy connecting one-to-one with fellow health practitioners from all over the world. Now, networking session 1, the topic is, what is the future of health? Session 2, what's your toughest immunization challenge? Session 3, why do you work for health? And so the next question, we asked you about expectations of Teach to Reach. Now we ask you, of these 3 networking sessions, which are you most interested in and why? And I'm going to turn, of course, to Charlotte to see who will speak first. Perhaps I can jump the queue and go to Kaiser Parvez. Unless Charlotte...
Yes, Reda.
Okay, great. So, Kaiser Parvez?
Are you able to...
Yeah. Otherwise, it would be great to hear from, let's see, who are some of the other folks. There are so many people in the room. Would love to hear from all of you. Dr. Manisha Danan, I'm glad to see you at Teach to Reach. Samuel Maloga Badiakeng is asking, as a hand raised. Flora Egu. And of course, if you are in, if you are in Hopin, so in the conference, in the Teach to Reach 8 platform, let's see. So Matthias Besong says, I have been a part of Teach to Reach from the beginning, and it's always been great to be a part of the event. For today's event, I would love to listen and learn to new things from my peers from around the globe in order to improve my own immunization work. All right, I see Samuel. All right, Dr. Manisha Danan.
Yes, sir.
A warm
Am I
welcome to
audible?
you. Yes, loud and clear. So tell us, remind
Thank
us
you,
who
sir.
you are and what you do. And of these 3 networking sessions, which are you most interested in and why?
Yes, sir. Thanks for the opportunity, sir. Myself, Dr. Manisha Dhanane, a homeopathic physician from India. It's an honor to speak on this platform, sir. I would like to share my experience in country. We have a COVID portal, post-COVID, for vaccination. It gives you the real-time data entry, details of the state and the central vaccines detail, their reminder calls, and geographical details, coverage details, correct figures, reasons for low coverage or area. So this came into invention when COVID was there, and it was only dedicated to COVID vaccine. But since routine immunization was hampered, we have come up with similar portal for the routine immunization schedule also, and it is also giving all the data, no manual entry, so there's no manual error also, some. So this is an post-COVID, we have seen a willingness from the citizens in taking vaccine as the vaccine awareness was there. And in a short, we can say that details of vaccination is just a click away. Thanks a lot for the platform, sir.
Thank you, Dr. Manisha Danan. You haven't told us what you do exactly, unless I missed it. And which country?
Sorry.
India.
Yeah, sir. So I work as a homeopathic physician. Post Ayurveda, homeopathy was born in Germany, and this is the pathy I use for work. And I work as a volunteer with social and government setups for vaccination as a volunteer, sir.
And
I
Manisha,
belong to India.
if unless
Yes,
I'm
sir.
mistaken, you're quite active on social media.
Yes, sir.
Okay, wonderful. Yeah.
Yes, I feel it's a great platform to put your words around the world.
Great. All right. Thank you. We look forward to your participation, and you probably already contributed to Teach to Reach. Boma Otobo says that she is most interested in why do you work for health and discussing that in the networking with colleagues. Joseph Paul Muneko is answering the previous question. He says, I expect to learn how other countries are making it to achieve in regards to HPV uptake. Reverend Flora Igwu is most interested in networking too. What's your toughest immunization challenge? Let's go to Flora and ask her why this is the question that you are most interested in. Flora, are you able to unmute? And I hope that you are. Let me see. And let me also check. Yes, okay, they're actually... all right, Dalia Silitanga says, good afternoon from Indonesia. Says, I'm Dalia, glad to see you here. Remind us, Dalia, where you work, what you do, and answer the questions as well, because we've got questions for you to tell us, so you can tell us, of these 3 networking sessions, which are you most interested in? So Flora Egwu is not responding. Charlotte, who shall we go to next?
Well, earlier on, we had Samuel Maloke Batiekang, whose mic was open, if he's able to intervene. And we also have Dr. Ibrahim Yissa.
All right, Samuel.
Good afternoon.
Don't forget to introduce yourself.
Good afternoon, good evening, and good morning, everyone. I'm Samuel Malogai Badiekang. I work in Ghana as a research officer. And not only this, we also provide routine monitoring and supervision to the lower levels to see how work is ongoing, and also support our health workers so that we could deliver effective health services to the people. And basically, for now, we are currently working on something on digital micro planning, how we could use QGIS and other digital technologies to support the delivery of vaccines in our various communities, as well as troubleshooting challenges that we face in our routine health work delivery. But for now, the future that I see with health is that there should be, in the future, we should see ways that we could use digital technologies to ensure that the barriers are removed for people, barriers that prevent people from learning or from adopting global best strategies that can be used to improve health. These barriers should be removed with the use of digital technologies. Personally, I've benefited a lot from this, from Teach to Reach, as well as from the Geneva Learning Foundations, where we also have other tools that are shared with us as ways that we could use them to improve the work that we do, and also learning from it. I think that is the future that I see for health. And I also expect that during this network session, the toughest challenge has been the use of evidence-based research within our local context for decision making. Is a challenge that I see. Less resources are committed to that. And with the session 3, I work in the health with the intention of working to improve people's health and remove barriers that prevent people from achieving optimal health. That's the main reason why I work for health. Thank you.
Thank you very much indeed, Samuel. Flora Igwu now has her microphone turned on. Flora, you'll be our last speaker for this segment, because we are going to shift to the tutorial where if you are new to Teach to Reach with Charlotte, we're going to show you step by step how to get the most out of the event, especially what you need to do to make sure you do not miss the networking. Flora, over to you. Remind us who you are, where you work, and then tell us of the 3 networking sessions, which ones are you most interested in attending and contributing, because you'll be networking is really one-to-one discussions with colleagues, and why? Oh, Flora has a microphone open, but we are unable to hear you. Don't know, Charlotte, if you can confirm. So I think we have one last thing to do. And thank you for those who are writing in the chat. I'm checking on Hopin and where the conference platform, where the networking is going to happen. And just for Ibe Francis or Ibe Uche from Nigeria, Maximilian Jomo from Cameroon, don't just say hello. We are discussing already questions. If you haven't started yet, you need to click on the you need to go to the stage and then click on the big button. Actually, let me reload here so you can see what it looks like initially. And you need to click on the big button in the middle to start the live stream, so you can actually see what's going on there. Now, one last thing that we need to do, and it's quite important. We met.
Hello.
Yes, is that Flora?
Hello?
Is that Flora?
Yes, it's Flora.
All right.
Yes, my name is Reverend Flora Ewu from Nigeria. I work with the National Obstetric Fistula Center and also with development partners like UNFPA and USAID and the rest of them. I'm not a health worker per se, but I work as a social worker. Ours is to go to the communities to sensitize people on to take immunization. But we have cultural challenges as barrier. We have a lot of other barriers like environmental barriers. So, but then with my learnings from immunization movement, I think we are pushing harder. And I want to learn from other countries the way they do their own, because I believe they equally have cultural challenges over there, though their culture may not be the same with us. But I want to know how they do their own to overcome their cultural issues, while I can adapt it to suit our own cultural issues here that are challenging us. A lot of people are now learning to immunize themselves, their children, but it is still at a very low space or pace. So that is the challenge we are having here because of culture. But we are going out sensitizing, creating awareness. Like during this COVID period, a lot of people said they will not take COVID injection because they don't believe in COVID. They don't believe in what is happening, and they run away from it. In fact, they say no to COVID immunization. And because they see that some people who even took the injection came back, the vaccine came back, complaining of one thing or the other. So that also made people to say no to COVID immunization.
Thank you, Flora. Yes, we've at Teach to Reach, as you know, we've shared a lot of experiences in how Teach to Reach participants have successfully challenged and overcome COVID-19 vaccine hesitancy. Now, we are slightly behind on the time we're supposed to be starting the tutorial, but there is something that we absolutely want and need to do, and that is to honor the participants from Bangladesh, Uganda, and Nigeria, who will soon be inducted as TGLF's ambassadors for those countries, as the Geneva Learning Foundation's ambassadors in those countries. So we have this is the outcome of a process run over the course of several weeks, starting with a call to action. And as you'll see, we'll start with the Bangladesh team, and in order to qualify as to be considered as a TGLF ambassador, as an ambassador for the Geneva Learning Foundation, we met over the successive weeks and really selected the most diligent, committed, and engaged individuals. So I'm pleased to introduce to you and to announce that these individuals, these scholars, these leaders of the movement for immunization Agenda 2030 will soon be inducted as TGLF's ambassadors in those countries. So, from Bangladesh, Dr. Shafiul Islam and Mohammed Shahidullah, as well as Dr. Khadija Ahmed, Dr. Tariqul Islam, Mohammed Sowar Alam, Mohammed Shahidullah, Mohammed Shamim, and Samin Hook. Now for Uganda, and I want to really warmly greet Ugandan colleagues. We had the pleasure of sitting down with some of them who were able to come see us in Kampala. I want to in particular acknowledge those who traveled long distances in order to join us. Again, we went through this process over the course of several weeks, and are pleased to announce that Akello Rebecca, Panina Dr. Tusima Ramadan, Ayamu Joseph, Gabriel Omoni, Helen Drashe Iraku, Hilary Okello, Muzakira Abdaya, Obanglamesh, Opio Mark, Patrick Benura, Sadi Ainibuna, Topher Biamukama. And you'll see some names twice who contributed in both ways. Here, Akela Rebecca, Amos Kijambu, Andrew Aruku, Anat Kisake Arabaptaya, Muzakir Beatrice Mutoni, Brian Sekayambia, Dr. Tusime Ramadan, Ayamu Joseph, Hilary Akolo, John Kamulageya, Muhangi Ambrose, Obanglamesh, and Sadi Ainebuna. I'm going to ask Charlotte to tell us a little bit about the dinner in Kampala with alumni of the Geneva Learning Foundation. Charlotte, what's your memory of this very special evening, which was just last week?
Yeah, it was a very rich and memorable evening, rather getting to meet face to face with and to connect in three-dimensionally with people that we had known previously just by name and by email. So to put the faces on them and also see the surprises on their faces upon meeting rather myself. So it was great, but also to see the mobilization of scholars from Uganda, some living 600 kilometers away from Kampala to join us in Uganda for that dinner. So it was heartwarming to hear firsthand from them what they were doing in their context to ensure that immunization services continued in spite of all of the challenges and difficulties that we were facing. So it was a great moment, rather that I would definitely like to relive in other countries with other scholars. Thank you.
All right, and now Nigeria, the same process. And this time I'm not going to read all the names because, as you know, Nigeria has the largest network of alumni of the Geneva Learning Foundation, and the exceptional individuals whose names you see here will soon be inducted as TGLF ambassadors for Nigeria. All right, I'm good. Now, we are 3 minutes over time. I do want to say before even the opening ceremony, let me go check if there are messages. All right, here in the event. So Abdurrashid Muse Yusuf, who says, hi everyone, have a good day. Abdurrashid, don't just say hi. We wish you to have a good day too, but please tell us, what are your expectations of Teach to Reach? For Maximilian and Jomo Chogang, the same thing. Let me see what is happening on the social networks. All right, lots of activity here. Let's go back and forge ahead here. Before the opening ceremony, we really want to show you step by step how to get into Teach to Reach. So this is actually the tutorial, so you should go have a link to the Hopin website. And why is this important? Because if you do not get to the hopin.com website and the Teach to Reach event on it, you will not be able to network. And once again, this is the most exciting and the best part of Teach to Reach. Charlotte and I, we do not want you to miss it. And so if we know that many of you are watching right now on YouTube, and that may be because you are not able to get, or Facebook or LinkedIn or Twitter, wherever you are, if it's because you have not been able to register in this platform, I'm now going to show you step by step how to do it. All right. So the first thing you need to do is to actually get to this page. Once you get to this page, then you can follow my instructions. So in order to get to this page, check your inbox. Pretty much every email we send you has the link to the networking website. So here, now that you see it, what do? So you can do a couple of things even before you register. You can look at the schedule, and here you can see all of the events, including the French ones. You do have to scroll down, or you can use the filters here. This is a little tip or trick. If you select the English tags, and then you see only the English language events. I know some of you were confused this morning or earlier today when the Francophones met. We have two separate sessions, one in each language, because the networking requires people to speak the same language in order to share their experiences. So now we're done with the warm-up. We're moving into the tutorial, and you can see this will be followed by the opening ceremony. You click on the little arrow here, and then you can also add this to your calendar. Now, once you can look at the schedule, but actually the first thing you need to do is to register. This is the only way you will be able to participate in the networking. And I can tell you it's a bit tedious. All right, it's not obvious how you do it. And many of you have gotten stuck, but I'm going to show you step by step now. So, ready? First of all, click on the blue button. All right, so this will load a page which has lots of options here on the left. Probably you want the first option on the list, English country-based health professionals. Unless you speak French, in which case you can choose the bilingual option. These are what Hopin calls tickets, but tickets as a term has confused a lot of people trying to attend Teach to Reach. So think of it as you just choose the best option for you. So if you speak only English, you choose the first option. All right. You can see here there's an order summary. So then once you have that order summary showing English, and don't make a mistake, because if you click Français, then you'll be networked with French speakers, and unless you do speak French, you won't be able to do much there. So now second, again, click on the blue button. Now it asks for basic information. That's for my first name and last name. Of course, you'll put in yours. Asks for my email. So let me see. Yeah, I'm just gonna use yeah, there. And then once you've typed in your first name, last name, don't make a mistake in your email. Many people, when you use email, you don't need to know your email, so they don't actually know how to spell their email. You need to make sure that it's spelled correctly. If there's even one letter or one number that is wrong, you will not be able to complete registration, because registration comes to your inbox email. So again, click on the blue button once you filled out those 3 fields, and then you get confirmation with a thank you for registering. And now the next stage actually happens in your email. So I use, let me see, where is it? Okay, it would be funny if it didn't come. Okay, yeah, and so here, this is actually, I'm actually showing you my personal email. I hope there's nothing embarrassing. And here you have a message that says, you're in Teach to Reach Connect 8. So here, now I did this demo for the Francophone, so you can see I have several of these. And here's the hard part, the not obvious part, that I think this platform needs to improve. So you see here, there's a calendar invite that says thank you, and then all the way at the bottom here, there's a blue bar that says enter event. So this is how you enter the event. You do not need a password. You do not need to create an account. Now, if you have a password or created an account in the past, you may need to, but if you're new to Teach to Reach in particular, and that means you're most likely to be having problems accessing the platform, this is how you do it. You now click on Enter Event, and this time you're going to see something very different. It is authenticating, and you will see once I'm authenticated, now you can see what's happening in the chat here. You have the list of all of the people attending Teach to Reach. All right. You can see here. Let me see, just so you can see better here. And you can reach out to them. You can connect with them in various ways. Now, first thing to do is the stage. And that is where you should be watching this plenary. So Eunice, Jacob, thank you for saying hi, everyone. Samuel Jansen has actually answered one of the questions. So we asked you, what is your expectation of today's Teach to Reach? Says the future of health in northern Nigeria. And again, Nigerians, we honor Nigeria and Nigerians because you are our largest alumni community. And we hope there'll be lots of discussions. We've heard in some cases Nigerians say, how come I only meet Nigerians in networking? Well, that is just the mathematics of the numbers. Now, you do have an event chat here. And Rachel Addo says, I'm happy to be here to learn from immunization experts. That's wonderful. I want to make sure that everyone who is on the platform currently knows where they should be. And that is, let me see. That is, you should be on the stage, and if you're not on the stage, then you're really missing out. So I'm just going to make an announcement, and you'll see what that looks like too. Stage to watch the plenary. So yeah, so that's all right, and you should see here an announcement come in. Please go to the stage to watch the plenary, and everyone gets that. And then when you click on this announcement, you'll see similar announcements if Charlotte and I have time to do them when you go to the when it's time to go to the networking. So Rachel, we'd like to know what you expect, which networking session is of greatest interest to you, and that is the tutorial. I'm now going to stop, mark a pause to see of those of you. So we sent a message. Charlotte actually sent a specific message saying, if you need help, join us in our Zoom studio where you can ask your questions and get help. So if you haven't been able to join the Hopin platform, please let us know. I'm going to lower all hands and ask only those who have a technical problem to raise their hands. That would be most useful. If no one is having problems, that's great, because that means there won't be any complaints later. If you are in Hopin, you can let us know as well. Just leave a message wherever you are. Daudi Manyanga has just joined us. Okay, Kenneth Micheni from Kenya is in for the first time. A warm welcome to you. Let me show you his initial message. Kenneth, can you leave us a message to confirm that you're not having any problems so far and that you've been able to access the platform just fine? So here. And let me see if there are any raised hands. Anyone having technical difficulties? It looks like not. So we have more time to go back into. Oh, was that someone with a technical issue opening a microphone? All right. So that's the tutorial. I hope that's a useful summary of how you actually get to Teach to Reach. And because Charlotte and I do not want you to miss the networking. All right. All right. So we actually have more time. We're done with the tutorial. I need to show you how to do the networking. So let me go back.
Rather, there's a raised hand from Innocent.
Okay.
Sengi. Yeah.
Innocent.
Sengimana.
Would love to hear from you. What's happening? Are you having a problem? I hope the problem is not unmuting your microphone. All right, and Francis Eno Asek from Cameroon joining this forum for the first time as well. Let's see if we can hear from Francis what his expectations are. Thank you for manifesting that you are and then Nantale. We tried to get you to speak earlier, but I think it was not working. So Francis, again, we're asking you to unmute. All right, Innocent. Yes. What are you having a specific problem with Hopin? What's happening?
Hello.
Yes, we can hear you.
Can you?
Do introduce yourself. Yes. Can you tell us who you are and what you do and where?
I'm Innocent Sengimana from Uganda, working with Kusoro District local government. I'm a medical laboratory by profession, and I've been assigned the duty of district vaccine store, Kusoro District local government. I've been trained as a EPI manager, World Health Organization, East Africa Center for Vaccine and Immunization, and participated in several exercises of immunization in Uganda. Glad to be on the platform of Teach to Reach Movement for Immunization Agenda 2030.
Thank you, Innocent, and good to hear. Good to hear your voice from coming in from Uganda. All right, let's see. We've got Burema Kabore. I'd love to hear from you, and then Dana Al Hassan. And if you'd like to take on any of the questions that we've covered so far, so which tell us what networking session you're most interested in, or tell us overall what your expectations are, or if you're having a technical problem, because Hopin is a tricky platform. All right, we still don't have any. Okay, so we have 3 microphones unmuted. Let's our rules for equity in the Movement for Immunization agenda dictate that Dana Al Hassan should go first. Dana, we'd love to hear from you. Tell us who you are, what you do, and then what either you're having a technical issue and we can try to help you, or you tell us which networking sessions you're most interested in.
Actually, I'm Dana Al Hassan from Ghana. I'm a nutritionist of profession with Ghana Health Service. Have working with maternal and child health related issues, and immunizations and 5 is what I'm so much interested in, especially aspects of children that come with adverse effects of concerning immunizations.
Okay, thank you. Now for Dr. Ibrahim Isa, who says he's had his hand up for more than 30 minutes. We tried to unmute you, but you did not respond. So just clarifying that, we really try to be fair. There's also a rule about equity between countries. So if a person from Nigeria has spoken, this should be followed by someone who is not from Nigeria, for example. All right, I'm eager to show you. I'm not hearing any big technical issues, so I'm going to actually show you the networking and how that works. That's very important. It's the heart and soul of Teach to Reach. It's the best part of Teach to Reach. We don't want you to miss it. So you see a speed networking here. Let me put this window away. And so I'm going to join now. And it asks, are you ready to meet someone new? So you click on join. Now you'll need to authorize, you'll need to allow the use of your camera and microphone. So I'm going to do that. And because I have poor connectivity, I'm going to take off my camera. You click on apply selection. And here we go. Usman Mohamed Tukur, connecting here and entering the conversation. Usman, good to connect with you. How are you? Dr. Usman, can you hear me? Hello, Mr. Usman. All right. Hello, Usman. Yes, can you hear me? All right. So this
yes,
will
I'm here, Ryder.
All right, wonderful. So I'm actually in the plenary showing everyone how to network. So if you'll indulge me, I'd like to show a couple of things to everyone, but great to meet you. So you see the first thing is you have a 5-minute timer counting down. You have 5 minutes to determine if you want to extend the conversation. Now, Usman and I have a good discussion, so I request to connect with him, and this will send an invitation with him. But he needs to accept the invitation in order for me to get his contact details. So Usman, can you accept the invitation if you'd like to be connected with me, of course? All right.
Yes.
Okay. Yeah. So you should see a button asking you to respond. Both participants in the networking need to agree to connect in order for the contact details to be shared. There is another way to do it, which is here, which is that you have a chat, so you can share your WhatsApp or use my email is this. And now you can see this extend button currently is not lit up, but as this winds down, you'll see that there's an option to extend beyond the 5-minute conversation. So that is how you can keep talking really as long as you want. But again, both of you have to click on the extend button. You don't need to do it at the same time, but if you don't both do it, the conversation will end. Thank you, Usman, for lending yourself to this demo. Have you been able to network with anyone other than me?
No, sir.
Not yet. Okay. All right. Wonderful. So we know some of.
Reda?
Yeah.
But I have a question, Reda.
Yes. Go ahead, Usman, and then
Wait,
we'll go to Charlotte.
How can? Hello, are you hearing me?
Yes, loud and clear.
How can I connect with other people?
Well, just like you did with me, in this case, there are others. When it's time to network, everyone will come to the networking session, and you'll do exactly what you're doing with me, but it's random. You don't know who you're going to get. In this case, you got me. Next time you do it, it'll be someone else. All right?
Okay. So now I should go back to stage now?
Yes. You can go back to stage, or we know some participants in Teach to Reach, they go straight to the networking, they know how it works, they don't bother with a stage, and that is fine with us. So if you want to keep networking, you can. But again, you can always look at the schedule here. You see the little schedule button, and you can see that the first networking session is actually concurrent with the with the main plenary. So you already have a choice to make there. Thank you, Usman. Take care.
Oh, thank you so much, Reda.
All right. So then if I want to leave, now if you find someone who's not responding or having connectivity problems, you can also leave for that reason. Yes.
I wanted to draw your attention. There is a comment in the chat from Surya Prakash Mishra that says, I tried this earlier and this works fantastic. An opportunity to connect and speak. But time goes so fast. So please be prepared to get the best out of the 5 minutes opportunity. So I wanted to talk about the opportunity of extending the time beyond 5 minutes.
Yes, absolutely. So you can absolutely extend the time, but both parties who are in the networking, need to click on the extend button. So if only one person does it because the other person doesn't understand that they can do that, then you need to be really explicit and say, do you see the extend button? Please click on that so we can keep talking. Otherwise, you will not be able to keep talking, unfortunately. All right. So that I think is the demo. Let's go to let's see. So I think
Kaiser Pavesh, whose hand has been raised for a long time.
Yes, indeed. Yes. All right. So we're asking Kaiser Parvez to. We tried again to unmute Kaiser Parvez, and it wasn't working at the time. But it looks like he's fixed his technical.
Hello.
Yes. A warm welcome to you.
Are you hearing? Hello, Reda. Are you hearing?
Yes, loud and clear.
I am Dr. Kaiser Parvez from Saudi Arabia, working in National Tuberculosis Control and Prevention Program. So my future is the future of health. What I believe is in future of health, artificial intelligence will take over in future of health. So we have to be updated about the latest artificial intelligence programs and that all regarding vaccination, everything is digital in future. So for my toughest challenges during COVID-19 vaccinations here in Saudi Arabia, surrounding from Syria disturbance and Yemen people, they came over here. They were asking that COVID-19 is it really, is it true? The person who already has taken a COVID vaccine has also died. What is the use of taking the vaccine? Strains will be changing. Like these questions were putting on. Then we have to convince, we have to fight for this COVID-19. It saves a life and that all. So finally, we have convinced a lot of people over here so that they took the COVID vaccination. Government has supported. If anybody is not taken vaccine, you cannot travel also. These things made us very strong to make fully vaccinated 99% vaccine in Saudi Arabia. That's all, Reda.
All right, thank you, Parvez. All right, we're looking forward to your contributions. Do you remember which questions you've already responded to? Because I believe I have seen your name as a contributor.
Yes, still nobody has asked questions. I'm still waiting.
Okay, all right.
Waiting, Reda.
Okay, great. All right, and then we've also got some comments over in Hopin. So this is where you need to go in order to be able to network later. So Dr. Faiza Rabbani here has introduced herself more extensively. We heard from her directly from the Zoom studio. She's currently a focal person on IHR, the International Health Regulations for Points of Entry in Punjab, looking after 3 airports and 2 land crossings. So think about it. If you Network with Faiza Rabbani. Think about everything you can learn from her practical professional experience on international health regulations. Ayodele Ajayi is an award-winning medical laboratory scientist. Well, maybe when you click on the networking, you'll connect with Ayodele and just imagine what you can learn from him as well as what he might be able to learn from you. And Funmilayo David from Ekiti State, Nigeria, an officer in charge of immunization in my district. Funmilayo David undoubtedly knows things about that district, about what is happening with immunization really. That might not be in the reports, but that he knows because he is there every day. And that is really the value of Teach to Reach. Now, again, we've had some very impressive level of contributions. You can see over 200 of you answered the question, why do you work for health? 120 answered, if you work in a humanitarian setting, what is your biggest challenge? 96 shared their experience of successfully introducing HPV vaccine. So we're going to wrap up now for this tutorial, unless Charlotte has spotted specific questions. Let me go back to hop in. All right, and wonderful to see Uganda so well represented alongside Nigeria and many other countries in Teach to Reach. Hello to you, Rachel Afayo Nakatuga. And of course, we stay discreet. It's true, we just had dinner with the alumni in Kampala, but we'd like to have dinner with alumni of the Geneva Learning Foundation in every country. That is our goal. So please, if we have not come to your country yet to meet with you, don't hold it against us. Now, you can also see that the full participants list here is available. I'll show you one more thing in the networking, but I don't know how well it works. You need to make sure you network with people who have the green dot, meaning they are actually online. And if you go to networking, underneath the speed networking, you'll see recommended connections. So this is actually, this platform has an AI, an artificial intelligence, that will help you connect, figure out who are the people that you are most likely to have productive meetings with. So the AI thinks that I should connect with Akukanda Tindye Bois. And if I want to connect with Akankunda, then I can send Akankunda a message, or I can request a meeting, or just invite to an instant video call. But right now, you should stay on the stage because we're about to kick off now that we're past the warm-up, the opening ceremony, which will be opened by women who deliver vaccines. So stay tuned. We're going to bring this session to a close and then come back with the opening ceremony, which will be on a different live stream. So once again, thank you. We're off to a strong start for Teach to Reach 8 with this warm-up. And you'll be seeing, if you go to the stage, you'll see that there'll be a change in the icon and what you see. So